Director at Midlands Medical Centre, and I'm also a specialist family physician. I can reassure you that we are exercising the social distancing of at least 2 meters. Self-isolation refers to patients that are voluntarily staying at home post-COVID-19 exposure, which means they are primary contacts of a proven clinically a lab-diagnosed person that has had COVID-19. Self-isolation requires of you to stay at least 14 days at home and to monitor symptoms. Quarantine refers to a patient who is COVID-19 positive and has to stay at home and to monitor their symptoms. Now, if a patient is symptomatic, it means that the patient has already been exposed at least 5 to 7 days and they've developed symptoms. What the patient thereafter needs to look out for is the progression of their symptoms. So after the 7th day up to the 11th day, that's when the cough, the tightness of chest may or may not occur. And this is where it is very, very important for the patient to monitor themselves. The 11th to the 14th day is really the critical time. It's either they're going to get better or they're going to get worse. And if they're going to get worse, it would mean they're having respiratory distress. By respiratory distress, I mean shortness of breath, a tight chest, difficulty with breathing, decreased effort tolerance, which means patient cannot walk a distance and is extremely short of breath. That patient needs to be hospitalized for oxygen management. And the day 14 to the day 28 of these very sick patients that need intensive care in a hospital, not necessarily in ICU, but in a ward where they could get oxygen therapy. After the 28th day, once the patient has recovered from his illness, we are now in the recuperative stage, and the patient might not have clinical signs of respiratory distress, but the patients are going to feel horrific. Horrific in the sense that the entire immune system was, at the time of the illness, mobilized to manage the disease. With the result is that the patients are going to feel extreme tiredness, both mentally and physically. They might find that they cannot perform as they used to. This condition, even though they're no longer infective, they're recovering from the disease, leads to what is called a post-viral syndrome, which is characterized by, as I mentioned, tiredness, weakness, muscle pains, joint pains, lethargy, listlessness, insomnia. It's a matter of time before the patient recovers. It can, in some instances, carry on for months and years. It then gets labeled as a chronic fatigue syndrome. The patient doesn't need any sophisticated medication. The most important management of this condition is bed rest, and bed rest. Lots and lots of fluids, high doses of vitamins, vitamin C, vitamin D, zinc, and a healthy diet and exercise. 99% of patients recover after a couple of weeks. Finally, for patients who've had COVID-19 disease, both symptomatic and asymptomatic, and they've fully recovered from the disease, doesn't mean you now have the right to go into society and not take the necessary infection prevention controls. The reason being that the chance of you getting reinfected, as I said, is minimal, but there is a chance after 4 months you could get reinfected, but you could be transmitting the disease from one person to the other, even though you might be reasonably safe in this small time period. So please do continue with infective prevention controls, and simply means social distancing, 1.5 meters to 2 meters away, your masks, and hand sanitizing, and hand sanitizing, and hand sanitizing.